Hi, I'm Matthew Clausen at MedigapSeminars.org, and welcome to video number 2 of our on-demand online series on Medicare to help you understand Medicare and your Medicare choices. In our first video, we talked about the initial enrollment period and how to enroll in Medicare. In this video, we're going to go over the pillars of Medicare, Medicare Parts A and B in detail. Now, as we do so, I want to remind you not to lose sight of the forest for the trees. Certainly, we're going to talk about some deductibles and copays, but that minutia is, I don't want you to get lost in it. I want you to remember, as we mentioned in the first video, is to ask yourself what it is that you want from your health insurance policy. And what you'll find in a later video is that Medicare supplements that you can add to your Medicare policy can eliminate virtually all of the Medicare copays and deductibles so that you have no out-of-pocket expense. So don't get lost in it so much as understand it for what it can do for you. Medicare Part A is free to anyone who qualifies for Social Security income. Even if you delay your income, as long as you're qualified, you will get your Medicare Part A for free. And Medicare Part A is that portion that helps cover your inpatient hospital expenses. Because Medicare Part A is free, most people will start Medicare Part A on the month that they turn 65. Your Medicare Part A coverage goes into effect the moment that you are admitted into the hospital as an inpatient, not in the hospital under observation, but as an actual inpatient. Now, this video is being produced in 2016, and as of 2016, there is a deductible for Medicare Part A of $1,260. After that deductible, Medicare Part A pays 100% of your medical costs as an inpatient for the first 60 days. It covers a semi-private room, it covers your general nursing care, 100% of your meals, and all of the drugs and other supplies that you receive while you're in the hospital. Keep in mind that the average hospital stay is only 3 days, so 60 days of 100% coverage is a lot of coverage. Still, if you are in the hospital after 60 days, then you'll pay a $315 copay from days 61 to 90 and a $630 per day copay from days 91 through 150. Medicare is not a long-term care policy. Your in-hospital coverage ends after your 150 days. If you're taking notes on the deductibles and the copay here, keep in mind when we talk about Medicare supplements in a later video that as long as you have Medicare Parts A and B, you can have a supplement, and that supplement will not only pay your deductible, but will provide you with coverage for a full 365 days plus your original 60 days of 100% coverage. Two important points about Medicare Part A. First is the $1,260 deductible is not an annual deductible, it's a per benefit period deductible. And a benefit period is considered any point where you've not had 60 days outside of the hospital. Let me give you an example. Let's say you're in an automobile accident and you're admitted into the hospital and you have a 5-day stay. They let you go home, and 2 weeks, 3 weeks later, either something related or unrelated happens and you're back in the hospital again. Because you were not out of the hospital for 60 days, that's considered the same benefit period. If you go back into the hospital, within the same benefit period, you don't have another deductible. If you are out of the hospital then for 61 days, 62 days, 63 days, however long after 60 days, and you go back in, then you will have another deductible. The second thing you need to know is that Medicare Part A does not cover physician services. Physician services are actually covered under Part B. Now, the physician services are what the doctor does while you are in the hospital as an inpatient. So, for example, if you are seeing a doctor for a condition and you're administered into the hospital as an inpatient, the doctor decides that you need a surgery. If he is not an employee of the hospital, he simply works with the hospital and that's where he performs those surgeries, then when you have that surgery, although the room, the anesthesiologist, and all of the aides will all be part of your Part A and part of the hospital, the doctor's fee himself for performing the physician's service will not be covered under Part A. It's covered under Part B, and we'll talk about that in a second. As a general rule of thumb, if you are an inpatient in the hospital and you have multiple services, anything that is billed directly from the hospital is going to be covered under Part A. If it's billed separately, it will probably be covered under Part B. So it is Medicare Part B that covers your outpatient and physician services. Medicare Part B has a deductible. It's an annual deductible, and as of 2016, it's just $166. Medicare Part B is also that portion of Medicare that has a monthly premium taken out of your Social Security income. Currently, that premium is $121.80 a month, and it increases based on your income. If you have more than an $85,000 individual tax filing adjusted gross income or $170,000 joint adjusted gross income, then you would pay more than that $121.80 per month for your premium. If you or your spouse have credible coverage from your employer, then you can delay enrolling in Medicare Part B. In fact, if you are getting credible coverage from your employer or your spouse's employer, you should delay getting your Medicare Part B, not just because it'll save you the premium every month, but also because there are guarantees associated with when you can enroll in a Medicare supplement or a Medicare Advantage plan that are predicated on the date that you start your Medicare Part B. So if you can delay it, you should. Keep in mind that insurance from the Affordable Health Care Act or Obamacare or from COBRA are not considered to be credible coverage. Now, as I had mentioned, in addition to the monthly premium, Medicare Part B has an annual deductible currently at $166. After you pay the annual deductible, Medicare Part B pays 80% of your outpatient and physician services, leaving you responsible for 20%. Medicare Part B generally covers 100% of approved lab tests and home health care, but keep in mind some routine lab tests are not covered or are actually covered on a timetable. For example, cholesterol is covered once every 5 years. Others may be covered once every year or every other year. When Medicare indicates that a service is covered every year or every 2 years or every 5 years, they are not referring to calendar years. They're referring to 365-day periods. So if there is a service that says they will cover it once per year, there needs to be a 365-day period since that previous test for Medicare to still cover it. Thankfully, Medicare has a great free online tool to help you keep track of that, and that will be a subject of another video. As you look at the services that Medicare covers, keep in mind one very important concept, and that is that Medicare will cover those services that are medically necessary. Now, let me repeat that. Medicare will cover those services that are medically necessary. It's a very important concept, and one we'll be bringing up later as we talk more about other Medicare choices. In general, Medicare relies on your doctor's diagnosis to help determine whatever is medically necessary. It may be also important to note that Medicare Part B is also what covers you for most of your cancer treatments and your chemotherapy treatments. Many people, when they first realize they have cancer and they know they've got some drugs or treatments, they actually look for see if those drugs are covered under their prescription plan and find they aren't and panic. When you have drugs that are administered either through your doctor or at your doctor's office, those are covered by Medicare Part B. Medicare Part D, which we will discuss in our next video, covers those prescriptions where the doctor writes a script and you go to the pharmacy and pick it up and self-administer it. Medicare Part B also covers some select wellness visits. When you're new to Medicare, you have a Welcome to Medicare preventive service that you'll get for free. Whenever you have a wellness service, you do not pay your copays or deductibles. Those are covered 100%. However, you must let your doctor's office know that your visit is a Medicare wellness visit when you make your appointment. Then, once a year, you're allowed for a new Medicare wellness visit, but again, you must stress or specify to your doctor when you make the appointment that it's a Medicare wellness visit. If you don't, then the odds are your doctor will give you a physical not covered by Medicare. Our next video is going to be on Medicare Part D for prescription drug coverage. If you find this information useful, then please like this on YouTube. Click the thumbs up button just below the video on the YouTube video, and share this with your friends. If you find this information useful, chances are others will too. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.